Pneumonia is an infection, but it affects the lungs, specifically the alveoli. A patient could develop pneumonia if they aspirate. That's when food or liquids enter the lungs instead of the stomach. They could also develop pneumonia if there's bacteria, a virus, or fungi in their body. There are four different types of pneumonia. The first one is community acquired pneumonia. That's when you catch pneumonia just being out and about in the street, anywhere outside of a hospital. The second type is hospital acquired pneumonia. That's when you've been admitted to the hospital and after 48 hours, you catch pneumonia. That means that you got it in the hospital. The third type of pneumonia is ventilator associated pneumonia, one that we have to pay very close attention to and try our hardest to prevent when we have patients on the vent. And the fourth type of pneumonia is aspiration pneumonia. Again, that's when patients are inhaling food, vomit, or liquid into the lungs. Some of the symptoms to look for in patients who have pneumonia would be a cough. And when they do cough, you want to assess their sputum. You want to see if it's green, yellow, or even red. Sometimes they cough and there's no sputum at all. So it just depends on how severe their case is. Since they have an infection, they'll have a fever. Sometimes they have chills. They'll be short of breath, especially when they're getting active. They'll have chest pain, and that chest pain gets worse when they take a big breath in. They complain of that often. And then when you listen to their lungs, you'll be able to hear the crackles and the rails. When you look at the chest x-ray of a patient who has pneumonia, you'll see consolidation and you'll see infiltrates. Those are white areas in the lungs. There will also be pneumonia in certain lobes of the lungs. And then you'll also be able to see scattered patchy opacities. That's bronchopneumonia. Those are the three types of x-ray findings that you need to remember when you take your board exams, your TMC and your CSE. If they mention those findings on an x-ray, then you know that the patient has pneumonia. The ABG results that we see when we draw from patients who have pneumonia vary. It just depends on how severe their case is. If they have a mild case of pneumonia, the ABG might be normal or the PaO2 might be low. If the pneumonia is more severe, we would notice hypoxemia and possibly respiratory acidosis if the patient's retaining CO2. We also do sputum cultures and blood tests. We look at the white blood cell count. If it's high, then that means that they have an infection. And the sputum test is going to be able to tell us what kind of bacteria or virus is causing this infection. When we give oxygen to patients who have pneumonia, the amount of oxygen that we give just depends on how much they need. They may only need 1 to 6 liters. If they need that, we can give them a nasal cannula and keep the O2 sat between 92 and 96%. If it's a more severe case, they may need a non-rebreather. If the PaO2 is super low, like below 60 millimeters of mercury, we would use a high flow nasal cannula or even a BiPAP. In the more severe cases of pneumonia where they start to develop ARDS, we would put them on a vent. Now, when we give medications to patients who have pneumonia, we give them medications that can help with bronchoconstriction. So we give a bronchodilator. We give them a corticosteroid for any inflammation that they might have in their lungs. And then we give them a mucolytic to break down any thick mucus that's building up within their lungs. If you have any questions, just let me know, but that's all you need to know about pneumonia.